So I'm presenting the result about distant metastasis-free survival result from the KEYNOTE-942 study, which is a randomized phase II study looking at the combination of mRNA-4157, or referred to as V940, in combination with Pembrolizumab, and comparing it with Pembrolizumab monotherapy, which is one of the standard of care treatment option available for stage 3 or resected stage 4 melanoma patient. The rationale behind this study is that there are two main points. One is that from what we know from the existing data, that about at 5-year time point, about 40 to 45% of the patients will experience disease relapse despite receiving effective adjuvant immunotherapy with drugs like Pembrolizumab. So there's still an unmet need that about 40-45% of patients will have disease relapse despite receiving these treatments. The second important point about our study is that, as I mentioned earlier on during the discussion, that the current immune checkpoint inhibitors are quite generic. So if I get 10 patients with melanoma in the stage 3 setting, I'll be generally recommending the same immunotherapy drug to all patients. And obviously it's not rocket science, it's going to work for some, not work for others. Whereas with personalized mRNA vaccine, so what we did in this study was that we took patients' tumor and blood samples and designed a custom specific vaccine for an individual patient, which targeted an individual patient's unique tumor mutation, which was different than any other patient on that trial that received doublet treatment. So our trial looked at the combination treatment to see if it will provide extra benefit in terms of clinically reducing the relapse risk and distant relapse risk on top of the standard Pembrolizumab. And that's what we found in our trial, that it led to about a 44% relative risk reduction in the risk of local relapse, as well as 65% relative risk reduction in distant relapse. So quite significant findings. And this is the first time ever that an individualized neoantigen therapy like mRNA-4157, or moving forward, we will refer to it as V940, has demonstrated improvement in outcomes.